All right. Good morning, everyone, and welcome to today's webinar. As Randy so kindly announced, I am Chelsea Smith, Learning and Development Specialist here at Action Benefits, spending some time with you today to talk about SNPs. Randy is joining me. If you'd like to say hello before we get started.
Hello.
Right, exactly. So we're here today, like I said, to talk about serving your most vulnerable clients with special needs plans. We purposely chose this topic today because there are some new ventures out here in the SNP world that we might brush on, well, we will brush on a little bit towards the end of our show. But before we get into that, we want to talk about the nitty-gritty ins and outs of SNP plans, so you can best serve your clients and sell those SNP plans to them this season. So before we get started, let's talk about what we are expecting us to get out of this session here today. So first, we can describe the requirements of a SNP. Very important to know what you need to have in order to even qualify to get a SNP in the first place. I can identify the additional benefits provided by SNPs. I can identify parts of the SNP enrollment process. A little bit different, not a ton different, but they are a little bit different than our standard enrollment process. And I can identify key elements to SNP plans available with Action's partner carriers. So I guess that gives you a little hint as to what I was referring to earlier. So snap into a SNP. I'm really proud of these titles for this webinar, ladies and gentlemen. So give me that. Please just let me have my dad joke moments for, every once in a while, laugh at in your office here. I'm proud of them. So what is a SNP plan? Excuse me. Special needs plans or SNP plans are health plans that are limited to populations with additional needs in comparison to the more standard beneficiaries Medicare was originally designed for. These plans were born in 2003 with the Medicare Modernization Act, and those who might consider a SNP will have certain diseases that are considered debilitating, certain healthcare needs that might be a little, that might stand out a little more than the average person, such as a need for some full-time care might be an option, or Medicaid. Functionally, they are similar to a Medicare Advantage plan. These plans, just like a Medicare Advantage plan, are managed by carriers but overseen by the government. So each plan is going to have a little bit of a different rule set regarding what is and isn't covered. But SNPs can also be HMOs or PPOs, and you do need to have parts A and B and that additional coverage for that special need. Enrollment in these SNP plans are only allowed if the criteria is met that the SNP plan is designed for. You cannot enroll in a D-SNP and not be Medicaid eligible in some way. You cannot enroll in a C-SNP for diabetes and not have diabetes. But if you are suddenly cured of that thing, we'll talk about that later on, which hopefully everyone has that problem. The SNP is so wonderful. You get cured, you don't need the SNP. That's our hope. So there are 3 types of SNP plans out there. The main difference between each one here is in this third level of the flow chart that we have here. First is the most common one, dual eligible or D-SNP plans. Not gonna lie, I hear people, including myself, sometimes call these SNP plans, which is like saying ATM machine. You don't need to say plans after because the P stands for plan. But that's okay. We know what you mean. I'm going to do it like 5 times at least. So, don't worry. They're not 2 different things. To have any SNP plan at all, excuse me, a beneficiary must be already enrolled in parts A and B, aka original Medicare. Once that is squared away, they must live in an area that offers these plan types. For those of us working in Michigan with Action Benefits, D-SNPs are offered with multiple Action carriers like UHC, McLaren, Humana, and Priority Health. And C-SNPs are offered with Humana in the Metro Detroit area. So if you're appointed with all of Action's carriers, you're going to know what's up here in the SNP space. We then must check to ensure that all of the qualifications for the plans are met. If the beneficiary has all of the aforementioned things and Medicaid, then that qualifies them for a D-SNP plan, and they can go ahead and sign up for a D-SNP plan when they're eligible for enrolling in something. Cool, awesome. If we're going to look at C-SNPs, those have 15 different diseases that one can have to qualify them to enroll for a C-SNP. depending on that plan, beneficiaries might have one or a combination of these 15 diseases. Hopefully they don't have all 15, that's too much. But if you have more than one, if you're diabetic and have asthma, you can get into one of those C-SNP plans for diabetes or for asthma, or if they have one that does combine those two together, you could go for that. I don't think there's one like that. I know there's not one in the state of Michigan that has two like that, but there are some out there in other states that might combine two diseases like that. But you do have to have one of the diseases that is listed within that C-SNP plan. A doctor does have to verify that the beneficiary has that disease in order to get approval to join that plan after they apply. So make sure your beneficiary has a doctor on deck to advocate for them, or a note from a doctor when they go to apply for that coverage. You don't have to have the note right off the get. You can apply without it, but I believe it's 60 days later, you do have to provide some sort of documentation saying that you do have that disease to stay on that plan. If you don't, you will be removed. And if special enrollment period does continue, and you can get on another plan. So there's not really a risk involved if you don't end up not getting a doctor's note, but it's obviously better to not have all that rigmarole going on and just have it in the first place. So there are 15 diseases, like I said. I'll list them really fast for you. Substance abuse, cardiovascular disorders, diabetes, severe hematologic disorders, certain mental health conditions, autoimmune disorders, chronic health failure, end-stage liver disease, HIV/AIDS, neurological disorders, cancer, dementia, ESRD requiring dialysis, chronic lung disorders, and strokes. Hopefully your client, again, doesn't have all 15 of those. That's a lot. But finally, if your beneficiary resides in a care facility, like a nursing home or a swing bed hospital, they can qualify for what's called an I-SNP. There is only one I-SNP plan in the entire state of Michigan, and it's not within a carrier that we work with Action. So we're not going to talk a ton about I-SNPs today and get too much into detail about them, but I am going to give you some brief overviews of them so you're at least aware of them and can have an intelligent conversation about them in regards to how you might need them as an agent in the state of Michigan. So that brings us to our first knowledge check. I know I dumped a lot on you right off the get, but I wanted to give you a quick question before we head on. But there is a question in the chat. Oh, that was just reading. Okay, never mind. There is no questions in the chat. So, which of the following would disqualify a beneficiary from a SNP plan? So not having parts A and B is the correct answer here. All of the rest of the answers on the screen would be a reason that someone would qualify for a SNP. You either should have a chronic condition if you're going for a C-SNP, Medicaid if you're going for a D-SNP, or live in some sort of care facility if you're going for that I-SNP. Having parts A and B are necessary to get a D-SNP or a SNP in general in the first place. So yes, make sure that your clients have A and B from the get before they apply for that SNP. So awesome job, everyone. Let's keep it on here with models of care. So for a SNP plan to be considered a SNP plan, it must have 4 elements that build upon one another to create a plan that offers more than what traditional Medicare would. So these 4 elements are a model of care, as we discussed earlier. So there must be proof, written documentation, that a plan does something more or different for their clientele that would not be provided within standard Medicare. It has to be measurable, and it has to be documented somewhere. Next would be a defined target population in need of that specialized care, such as being Medicaid eligible or being diabetic, something like that. Plans can, again, like we said, target more than one condition, but they can only accept those who have the conditions that are targeted. And if the person winds up not having that condition anymore and gets better, that's awesome, but you gotta find a new plan. You're not in the club anymore. So then we have care coordination. This means that all of the providers working with the beneficiaries should be in regular communication with one another and have that documented somewhere. This, in theory, would lead to more effective and to safer care for that person who has those higher risks because they either have that lower income or have that debilitating disease or are living in a facility where they are more exposed to other diseases and such. And then last but not least, we have performance improvement. So these plans must demonstrate with data and with action plans their ability to improve the quality of the care that their plan offers. And if they are not meeting those standards, they have to have an action plan to get those standards back up to par again. So SNP plans must remain compliant in order to be sold. And in order to remain compliant, SNPs must provide a report detailing even further what exactly it is that they do differently than standard Medicare. So their plans are submitted for approval by the NCQA, and plans must earn a score of 70 or higher to remain compliant. Plans get a one-time chance to fix and resubmit their plan, their performance plans if they don't achieve that score that they needed. And the higher the score, the longer the approval can last. So I believe it's up to 5 years that they can in advance be approved if they get like a 90-something% on that score. I guess it really doesn't matter to you as long as it's available, right? So these plans must be submitted every time a new plan is created or a new service area is targeted as well. So if they want to expand these plans out of the Metro Detroit area, say we're hitting up some of those DSNPs that are in the Metro Detroit area, they want to move up to the UP, they want to hit more clients, they would have to resubmit to make sure that that plan is doing all those things we talked about in the slide before, making sure that they have a proper model of care and they're hitting the clientele that they're looking to help. So SNPs include some different benefits than standard Medicare. So first, there are premiums attached to SNPs that are separate from Part B or the potential Part A premiums that you might pay, and deductibles. They're set by the carrier and vary by plan. However, DSNPs might have reduced or eliminated premiums due to federal government covering those premiums. Plans that have cost sharing available must be labeled as Medicare $0 cost sharing plans if they are eligible for that, or Medicare non-$0 cost sharing plans if they are not eligible for that. And we'll talk about how you can figure that out later on in the show. But that's one aspect. Prescription drug coverage, or Part D, must be included in a SNP plan by law. So you don't need to shop for a Part D plan for your snippers if you wind up getting them on one of those SNP plans. And again, we'll talk a little bit more in detail about what that means for things like extra help momentarily. But like we said before, your beneficiary will still be responsible for Part B premiums if that's something that they are responsible for, if they don't get cost savings programs, and Part A if they didn't work that 40 quarters. Networks are dependent on plan design, so a SNP can have an HMO or a PPO network depending on that plan, and that means that beneficiaries might need a PCP if they're going for that HMO plan. They might have out-of-network coverage depending on the plan as well. That might be an option. Like I said, I feel like I've said like 6 times already, they do function very similar to a Medicare Advantage plan in that regard. Next is model of care. Every SNP plan by law must have a model of care, or MOC, associated with the plan. The plan must illustrate the basic ways that the needs of their beneficiaries will be met under the plan. SNPs are not able to charge more for certain types of care than Parts A and B, so costs should remain similar to standard Medicare. However, higher copays can be put in place for services like home health care, durable medical equipment, or inpatient hospital care. So those are the only places that the prices for your plan might differ a little, but most of the time, you should see similar pricing models to a Medicare Advantage plan or standard Medicare. And then finally, we have prior authorization requirements. Unlike with other plans, once a provider gives you approval for treatment, that approval must remain valid for the entire time that that treatment is needed. And we will mention that again later on in our show. So prior authorizations require that the provider ask for approval from the plan before giving the go-ahead for a treatment or a procedure that might, well, I do that once a webinar, sorry. Go ahead for a treatment procedure that might be costly, such as a surgery, right? And if that approval is not granted, it will not be covered, and the beneficiary would be responsible for paying for that procedure. Kind of standard, par for the course, right? Prior authorizations have the potential to make treatment more complicated for beneficiaries, because prior authorization might not carry over if anything changes for them between the time they get that authorization and when they actually get the treatment, such as a change of their plan, a network change, or a provider change. And some of those things are outside of the beneficiary's control, right? But with SNP plans, once that prior authorization is given, it cannot be revoked for any reason at all until the beneficiary gets that care, regardless of any changes that might happen between when the authorization is given and when the care takes place. So keep in mind this factoid in case you have a beneficiary that's going to be getting a lot of procedures done and are worried about getting those stamps of approval for those procedures, a SNP plan, a C-SNP plan specifically, might be a really good fit for that client. Again, maybe not the only reason you're going to push them into that SNP plan, but a good option to keep on the table for someone who might have been burned in the past by prior auths. Okay, that was a lot. So let's head into knowledge check number 2. So which benefit listed below is not available in SNP plans? There is no free access automatically to dialysis if you are in a SNP plan. The rest of these are offered within SNPs. Dialysis must be covered at the same price as original Medicare, though, but it's not necessarily going to be free off the get. I'm going to go ahead and bet that it's not for any of them, but you know. So paying for a SNP. What do premiums and cost shares look like in a SNP? A little different, like we said, than other plans in the past. And it actually can be a little complicated, but we're going to walk you through it. It's going to be fine. So in order to calculate the cost of a D-SNP, we have to take multiple steps, starting with the cost savings programs that are associated with Medicaid. So premiums will be figured a bit differently here than in standard Medicare. SNPers will be still responsible for their Parts A and B premiums, since they do need to have both of them in order to sign up for a SNP plan. And as we know, for 2024, Part B is about $174 and change. As we mentioned earlier in the show, most of us get free Part A, so probably don't need to worry about that. Next, we add in the SNP's premiums. But if the beneficiary is signing up for a D-SNP, they probably will have part or all of that premium paid through a rebate dollars from the government. Those rebates go directly into the plan, and the plan can then use that money to supplement the plan in other ways, similar to the way Med Advantage do. To us average Joes, that rebate problem would be called a Medicare savings program. Boom. Since the rebate isn't going directly to us, the consumer, we don't consider it a rebate. We just kind of consider it as, oh, like, you're not having to pay your premiums. But the government is going to call it a rebate. So you might hear it called a rebate sometimes, depending on the perspective of the person who you're speaking to. But most of us in our discussions we're going to have regarding this process, we're probably going to call it a Medicare savings program. But the plans themselves get paid by the government on the consumer's behalf, or at least the premiums do. This isn't always the case. There might be some cases where the person is responsible for their premiums. But there are some plans that wind up being discounted or free due to these government rebates, due to these savings programs. But what the beneficiary qualifies for will dictate what plan that the beneficiary can take on and how much they're going to pay for that plan. And then voila, that's about it. No separate Part D premiums. Remember, because a PDP must be included in those SNP plans. So in this next slide, we're going to talk about how these rebate dollars can be applied based on what beneficiaries qualify for and what Medicare programs coordinate with that plan. Before we even talk about the coordination, though, let's refresh really quick what these Medicare savings plans are. There's a lot, and they're similar sounding, and they're goofy sounding. If you just say them, it's going to be fun. You just watch. So first, to understand what the cost of a D-SNP plan might be for that beneficiary, we must first figure out how that beneficiary qualified for Medicaid in the first place. These programs are listed here, and the first one is called the Qualified Medicare Beneficiary Plus Program, or QIMBY. The Specified Low Income Medicare Beneficiary Plus Program, or the SLIMBY, which both covered in regular and plus flavors, and the Qualified Beneficiary Program, QI program, or last but not least, the Qualified Disabled Working Individual Program, or QWDI. There's not like a thing for that I know of. And the Full Benefit Dual Eligibles Program, or FBDE. There, got there. Whew. The Qualified Medicare Beneficiary Program, that one all the way on the left-hand side for you, or QIMBY program, as it's more often called, pays the full cost of Part A and B premiums, Part B deductibles, coinsurance, and Medicare covered copays. Beneficiaries might be responsible for small Medicaid copays, but will not be billed for Medicare covered services. Next, we have the Specified Low Income Medicare Beneficiary Program, or SLIMBY. This program supports are limited to full payment of Part B premiums. The program does not assist in any other cost sharing. And then, unlike QIMBY, SLIMBY does apply retroactively and can apply retroactively for up to 3 months. Qualifying individual or QI plans or QI program is designed to provide help with Part B premiums and not necessarily pay for all of it. And then lastly, individuals, this one's a little wonky in comparison to the other three, but individuals who have a disability return to work and then lost their Social Security disability benefits because of that, and that premium-free Part A benefit as a result of no longer being able to work, can qualify for this plan and get their Part A premiums paid for. If they had worked at one point and then got hurt and were not able to fulfill their 40 quarters. So unlike the programs discussed so far, this program will only assist with Part A premiums, and it helps offset the costs incurred because the beneficiaries lost their premium-free Part A eligibility. So after we go through all of these, the flavor of the D-SNP plan that the beneficiary is going to qualify for is going to correlate with the Medicare category that they were eligible for. So now that we've got these squared away, let's step into the D-SNP levels in regards to these Medicaid cost savings categories. So there are 5 D-SNP types, all with varying levels of Medicaid coverage, and they're over here. And let's go into what these all translate for your clients. So first is the all dual at the top there, which means, as you probably might imagine, that the individual qualifies for all aspects of both Medicare and Medicaid. Most people who are on a SNP plan are in this category. There's about 12.5 million Americans in this category last time it was counted, and it is the most popular category. Those in this category qualify for all cost-sharing programs available to beneficiaries, and these programs we just talked about on the previous slide, which are on this row of the chart right there. So next we have full benefit, the second one underneath all dual right there on the left. Excuse me. This category includes dual eligibles who qualify for full Medicaid benefits for the month under in any eligibility category, or medical assistance for any month if the individual was eligible for assistance in any part of the month. Then we have Medicare zero cost sharing. Those who fall into this category qualify for a D-SNP due to being Quimbly or Quimbly Plus eligible. They will not be responsible for any cost sharing for Medicare Parts A and B. Because the beneficiaries in this category aren't entitled to full Medicare benefits, though, they might have some cost sharing involved in the Medicaid side of this process. Then we have dual eligible subset. And those who fall into this category are eligible for D-SNP because the state has determined them eligible, and the carrier has verified that information with the government. Since each state is different, the qualifications for this category is going to vary depending on the state. And these beneficiaries will qualify for all Medicaid categories, just like the all dual program. And then finally, we have dual eligible subset Medicare zero cost sharing. This category is the same as the category previous, but as you might guess, it follows the pattern of a dual eligible zero cost sharing, meaning they will not be responsible for A and B cost sharing. There are a couple other SNPs that are available in the country, such as FIDE and HIDE, but they're not in Michigan, so we're gonna skip them. Okay, so extra help pairs very nicely with most other Medicaid savings programs to create a comprehensive support system for those beneficiaries that qualify for D-SNPs. So this program, with over 14 million enrollees and counting, could be enrolled in automatically if the beneficiary is eligible for other programs like Medicaid, supplemental security income, Quimbly, Slimly, or QI. So your D-SNP people. Beneficiaries might also qualify based on their income and resources. A few other requirements, such as being enrolled in Parts A and B and residing within the U.S., must be met as well. So there once was full and partial versions of extra help depending on the income level of the beneficiary, but in 2024, that's not going to be a thing anymore, so you're not going to have to worry about that. Both tiers are going to be rolled into one tier. Those with partial help currently will automatically get full extra help. And everybody will pay no premiums or deductibles due to the Inflation Reduction Act. What it is going to affect, though, what still is going to change and still be around, is the cost of the drug itself. So in 2024, there will be a $4.50 flat fee for generics and an $11.20 flat fee for brand name prescription drugs. So I'm sure you might be asking me at this point, why are you talking about this if there's no need for Part D coverage with a SNP? They automatically get drug benefits rolled into their SNP Chelsea, what are you talking about? Well, that's because extra help can be applied to a SNP, not just Part D plans. So if your beneficiary qualifies for that SNP, they're probably going to qualify for extra help too, and they get to enjoy all the benefits that are listed here, in comparison to having to pay full price or co-pays, whatever, with their drugs. So let me see you SNP enroll. So how does enrolling in a SNP plan differ from standard enrollment? It begins just like any other SNP, right? So SNPs are available for quoting purposes, just like they are in any other situation. I'm going to shamelessly plug coverage for one here for a moment. Everyone's favorite quoting and enrollment tool for their Medicare business, and show you what it looks, how it might look a little differently for you if you are going to try to quote and enroll, or quote, I should say, also enroll your client into a SNP in comparison to that standard enrollment process. If it's available, you as an agent can use the client's Medicare number to look up their qualifications for extra help. Right here. Right there, actually. To make sure you get accurate quotes, though, be sure to include the zip code that the SNP plans are available in, and make sure that you select special needs right there when it prompts you to in coverage for one, so that they will appear in your search. You can select more than one, but if so in case your client doesn't end up wanting a SNP, that's okay. They can look at all their options and compare. But if you just want special needs, make sure you're selecting special needs, and it will end up looking like this once you hit that enrollment. The SNP plan will show up just like any other plan in the quoting process. But Chelsea, we just talked about how complicated it is to make sure that I qualify, that my client qualifies for a D-SNP. There are so many different Medicare cost savings programs. How am I going to know which one they qualify for? Let me tell you, really easy, right there. Just look right there. Just look there. Once you want to quote for the beneficiary in coverage for one, you can see which type of SNP is covered by which plan by taking a peek at the labels right next to the star ratings. This way you can know what plan is available for your beneficiary depending on what cost savings program they are eligible for. I picked this one simply because it is qualified. It does have all of them on there. As you can see, other ones are going to have just the ones that they qualify for. Cool. So, and C-SNPs will tell you right in the name of the plan what they are meant to cover, right? So this is the one SNP plan. So I'm soft dropping what the special thing we wanted to talk about is, but the C-SNP plan that is available in coverage for one that you will see when it is listed is going to say right there in the title of the plan itself that it is a diabetes and heart C-SNP plan, meaning that your client will need to have one of those conditions in order to qualify for that plan. So we did talk about how that did need to be verified. We mentioned it a little bit earlier. Each plan will have its own process to ensure that the client is going to qualify for that SNP plan. So each flavor of SNP is going to have its own gatekeeping associated with it to make sure the model of care is actually addressing the needs of its population. So D-SNPs are going to be fairly easy for both you and the beneficiary to verify. So long as they qualify, they can either provide their Medicaid card if they have one already as proof of insurability, or if they provide all the necessary information in the application, the plan is going to verify their status for them. And then like third way, like we mentioned earlier, is if they have a Medicare number, that's going, their status is going to be linked to that Medicare number. So that one's a really easy one to get checked, I guess, or to make sure that the beneficiary qualifies. C-SNPs of the three are probably the one you're gonna have to look out for the most. It's not that it's necessarily difficult, it's just the fact that the client can just apply and not have to prove that they have this condition, but they do have to eventually go back and provide some sort of proof to the plan before they are officially allowed to stay on for longer than that initial enrollment period or initial enrollment process. C-SNPs are of the three, like I said, the one you have to look out for the most. It's not really that it's hard to get into them. It's just that beneficiaries need to have that doctor's note at some point within 30 days of the application. If no note is provided after that point, the beneficiary, even if the beneficiary gets enrolled and is found eligible for coverage, that coverage does end up being removed. That risk is pretty low though, because if they try to get on the plan and are not able to stay on that plan for this reason, they get a 60-day special enrollment period to enroll in a new plan. And that enrollment period will begin when they are first notified that they're being disenrolled. So they'll have some time afterwards if they do end up not getting that note from the doctor to find something new. But if it were me as an agent, if they had that note available, I would get it in as soon as possible just to avoid all this, or get them or make sure that they're aware that this is something they would have to get, and have them set up an appointment with their PCP ASAP to get that note available.
We should point out here that when applying for a C-SNP with Humana for that diabetes and heart condition, that Humana, as long as you list a doctor, the member lists a doctor on the application, Humana will attempt to reach out to the doctor only once on the beneficiary's behalf to gather the information. But if the doctor is slow to read their email or on vacation or otherwise misses that ask, then they're going to be out of luck for coverage with that plan. So while the plan will take some action to verify the member's eligibility, as Chelsea's been saying, it's a great idea to have that documentation already in hand when you go to apply. It really streamlines the whole process for your member.
That's really cool. I did not realize, I guess I did know that, but I forgot it, that there are that Humana does that. And if that's the only plan in our area, that gives a nice cushion, like to eliminate one of the barriers that might be in place for your clients and to sign up for that C-SNP. Maybe they're nervous about what their doctor may or may not do. Well, at least Humana will take that first step for your client. I like that. And then last but not least, we have I-SNPs. And like I said, there is only one I-SNP in the state and not available with an action carrier. So I just want you to know something about it to have an intelligent conversation. But beneficiaries to qualify for an I-SNP have a variety of ways to prove that they've either been in long-term care for at least 90 days or will need at least 90 days of long-term care in the future. They can just get that verified through the facility or through a nursing home. So what happens if my client gets better, and what happens if they no longer have the qualifications to stay in a C-SNP, or if their income level changes and they're no longer under that poverty level that would qualify them for a D-SNP. If that happens, it's okay. It's not the end of the world. These policies are written by the plans, as we know, so every plan is going to be a little different. But in general, with all SNP plans, beneficiaries will have between 30 days and 6 months to regain eligibility before they end up getting removed from the plan. If they remain unqualified for the plan at the end of that grace period, plans are required to notify them in writing within 10 days of the plan, realizing that the beneficiary no longer qualifies and will be termed if they don't regain eligibility. If they still don't qualify after that, the plan is required to inform them once again in writing that the plan is going to be terminated. And then post-term, beneficiaries get an SEP starting the month that they are terminated, just like that's the SNP plan. So again, it's not like they're going to be left hung out high and dry if they end up not qualifying later on in their Medicare career. They're not going to be just given the boot right away. They will have some time to make some decisions for themselves. So really, there's not a ton of risk involved in trying out a SNP if you think it's right for you. So that brings us to yet another knowledge check. Mo, 66, is retiring this month, leaving her without group coverage. While she was working, her income qualified her for Medicaid. She comes into your office for health insurance advice. What would you suggest based on what we know so far about her? Okay, yeah, so apply for a D-SNP. Yeah, I guess in theory, applying for a C-SNP isn't necessarily wrong, but we don't know based on the information we have about her if she would qualify for one. If she does mention later in your needs analysis, oh, I have I don't know, mental health condition, I have diabetes, I have whatever, I have asthma. Sure, maybe see if there's a plan available to her in her area, but we know at least for sure that she qualifies for that D-SNP plan. So trying to steer her in that direction probably is a good idea. A SNP sale name desire. So how to work SNPs into your sales appointments. So this is really, to me, this is really a no-brainer. Agents, if you're doing your due diligence, you know that a needs assessment is so crucial at the beginning of your appointment. And again, we're going to humbly suggest our own documentation here because I'm biased. I'm not going to lie. That sheet is great. So when you have that needs assessment sheet in front of you, you know you're going to ask all the right questions to get your client exactly what they need. So that coverage for one sheet is going to ask about specialists, chronic conditions, PCPs, medications, and more. Filling that out with your client before you start the quoting and enrollment process is so crucial if you want to make sure you're going to meet the needs of your client, because you're not going to know unless you ask, right? And that sheet will make sure you remember. This will help you pinpoint people who are interested in those SNPs. And don't forget about what we mentioned earlier as well about looking up someone's Medicaid status using their Medicare number if they have one. So that's another way that you could check to see at least if they're qualifying for a D-SNP. You could use that Medicare number if they have one in your enrollment process to check that as well. The sheet won't ask for their Medicare number, but you can ask while you are filling out that portion before the quote in coverage for one. So taking actions with the SNP plans. Oh, we have a question before we keep going here. Oh, no, that was just Rand telling us about how wonderful the sheets are. Again, see, we're biased, but we know our stuff. Those sheets are wonderful. Perfect. Chef's kiss. All right. Anyway, so I've been talking for quite a minute, and I guarantee you're tired of hearing this situation. So I'm going to pass it to Randy for a little bit so he can talk a little bit more about the types of plans that the SNPs that are available for us with our partnered action carriers. So without further ado, take it away.
Thank you, Chelsea, and thanks for that kind of primer, right? For knowing where the all the technical knowledge behind SNPs and who qualifies and how they qualify and all those sorts of things. What I want to spend a few minutes here at the back end is showcasing some of the products offered by our partner carriers. By no means in the next 18 minutes of your lives are you going to get a thorough product education across the 4 carriers we'll talk about today. But we'll point out some things that we think are valuable features for your clients going forward. And in fairness to all, we're presenting a few highlights from all of our carrier plans. And so that you'll be able to kind of make an educated decision based on what's your portfolio, or if you're real curious, talk to us about adding some more to your portfolio as well. So Chelsea, go ahead and show us the next slide, please, and we'll show what we're talking about here today. So we'll talk about Humana and highlight the 2 D-SNPs that are available to your beneficiaries if you choose to roll with them, and that C-SNP, which has a lot to like as well, especially for your folks who might be on heart medications. We'll then talk about McLaren's single D-SNP offering. We'll talk about 2 D-SNPs from Priority Health, and quickly put head-to-head 3 D-SNPs from UHC. Chelsea, let's talk about Humana. All right, first talking only about Humana SNPs, D-SNPs rather. We'll come back to the C-SNP in just a moment. A few things to point out about these D-SNPs from going left to right. First thing you'll notice in that first sort of comparison line across them is that they're available for different Medicaid populations. So starting with that Humana Choice PPO, you've got a wide variety of, that's available statewide for a wide variety of Medicaid levels. In the middle, the PPO that's available in most Michigan counties is available for your Quimby's and Slimby's and anyone who's full benefit dual eligible. That Gold Plus HMO, which is available in some Michigan counties, i.e. the most populous ones rather, that Quimby's, Quimby Plus and Quimby, there's some things to look at there. So a variety of things to look at. But here's some benefits we think your beneficiaries could get some mileage out of here. Starting with Humana Choice on the left, there's a $2,000 dental allowance, including dentures. And you'll notice across all 3 of these plans, that they include dentures inside that dental allowance. That HMO plan, again, available in Metro Detroit and some other metropolitan areas, does have a $3,000 dental allowance for your clients who might need that sort of work done. One benefit we really appreciate out of Humana's plans, and frankly, where they beat any other carrier, is in the transportation benefit. Especially if you have someone who might be living in isolation, who is living on their own, doesn't have regular transportation or means to make it to their medical appointments. On those two Humana choice plans on the left, they offer 100 one-way trips for 75 miles. In the Metro Detroit area, they offer 100 one-way trips for 50 miles. So that's 50 doctor visits or 50 other visits they can make it to each year, there and back round trip, which really helps ease that barrier to care. You'll also take a look at these healthy foods, all those sorts of things. There's a variety of balances there as well. Marty asks us, are there limitations for those Medicare recipients under 65? Marty, I think you're asking us about what plans might be available. If D-SNPs are, only some D-SNPs are available to those under 65. Let me know if I have your question right. Okay. So just like Medicare, so it's not like Medicare supplement, right? Where for those under 65 can only enroll in a plan A or a plan J, or whatever the case might be, right? Based on those carrier rules and what they offer. For those under 65, so long as they meet other eligibility rules for that. So if you have someone that is under 65 and is eligible for both Medicare and Medicaid, they'd have access to whatever plans you offer. Let me know if that helps, Marty. And let's go ahead and talk about McLaren next. So McLaren offers one SNP. What you'll notice here is a $50 per quarter over the counter alliance. And anyone that qualifies for extra help, so most of your Medicaid eligibles should qualify for this here as well. What they have is an interesting wrinkle, as opposed to a silver sneakers or anything else sort of thing, something that's kind of tied to a program, is a $200 per year reimbursement for a fitness membership. So if you're, especially if you're working in an area, McLaren service area, which is most of the Lower Peninsula, and especially where they're saturated over on the east side here, and sort of in the Flint area as well. Maybe they don't have access to some of the more popular gyms or whatever, or the local gyms don't participate with silver sneakers or with another fitness plan or program that you have. That reimbursement could be a good opportunity for them as well, assuming they're up, mobile, able to go around. And again, there's a $0 drug copay for anyone receiving extra help, so long as they enroll in that plan. Chelsea, let's talk a bit about priority next. We should note that these two plans, the D-SNP HMO on the left side, is available throughout the Lower Peninsula. The D-SNP Advantage HMO is available in select Lower Peninsula counties, Region 5, if you are familiar with Priorities region. So most of Metro Detroit, some of the Flint area, and a few counties out on the west side. There's some things right off the bat that really pop out to us about these plans, though. First thing is looking at that Priority Medicare D-SNP. That on your left-hand side, there's a $222 allowance per quarter for things like utilities, pest control, OTC, and healthy foods. By far and away, that is one of the richer benefits that we've seen out there, as long as your clients are going to use it, right? So that might not be the only determining factor of where you go. Oftentimes, OTC cards go unused by your clients, but if you've got someone who's a regular, habitual user of them, could be a good fit for them. They do offer 100 years of priority care supported by, or 100 hours per year, not 100 years, of priority care supported by PAPA, just as they do on their regular MA plans. $0 drug copay for those receiving extra help. And on that plan, there's a $2,500 annual max for both preventive and comprehensive dental. Does not, may not include dentures. I'd have to go back and verify that one. Humana is very in your face, though, about including dentures, and I'm happy to look back at that for it, anyone who would like so. Me too. Oh, hold on. Got one more to talk about with priority. You'll see on the right side, on the one available in the metro area, there's a slightly lower, well, it's a different allowance, right? It's $160 per month. So it's not a lower allowance per quarter, right? It's in fact, you're getting $318 per quarter. Doesn't roll over, so it gives your beneficiaries the opportunity to spend on things like healthy foods and utilities and so on and so forth. So that's a big help for them. You've got your priority care there, but you've got one of the richer dental benefits on offer in the D-SNP market, $4,000 annual max for both preventative and comprehensive dental. That's something you can't beat, especially if you're working with someone who may need a lot of dental procedures going forward. And again, $0 drug copay if your member receives extra help. Now let's talk about UHC. So UHC offers 3 options, and what I really want to call out for just a moment is the plan on the right. You'll notice that in the first line, the UHC Dual Complete MIV001 HMO-POS-D SNP. That is a partial available for people who have partial Medicaid eligibility. So maybe they're lower income, right? But they don't quite qualify for that QuimB or SlimB program. Maybe they're a QDWI or a QI. They may pay a premium up to $38 or so for accessing this plan, and going on a sliding scale based on their income. But that is an option for someone who does receive Medicaid benefits but isn't eligible for any other cost-saving programs. You'll notice across all of them, there's again a $0 drug copay, so that's always a big help to your beneficiaries. You'll see the dental allowances there. The $3,000 benefit here in the middle being the richest one that you'll see there. On that partial plan, we should point out that the allowance is a little bit lower. There is a $0 copay for most services, but there's a 50% co-insurance for any dentures or bridges your clients might get if enrolled in that plan. You'll also see the OTC benefit, that dual complete HMO POS-D SNP 2 in the middle is the richest benefit they offer here in that case, $198 per month. If that is the benefit that is really driving some of your clients' decision-making, that could be a good option for you to take a look at as well. And let's close by spending a few minutes with Humana's C-SNP. So long name here, Humana Choice PPO H5216375 MAPD. As Chelsea mentioned earlier, it is available in select Michigan counties for those with diabetes and or heart failure and or heart disease. Unlike the D-SNPs we've talked about, which for your D-SNPs are pretty much $0 cost sharing plans for a variety of covered services. Even when they go to the dentist, right? They have that annual max, but they're not paying anything when they go to the dentist. The C-SNP is not a $0 cost share plan, but I do want to point out some things that do really make this plan palatable for folks who may have one or more of the 3 conditions outlined here: diabetes, heart failure, and or heart disease. Select heart drugs, and if you want to name some for me, I can go back to the formulary and look them up specifically. But select heart drugs are placed down a special tier 6 of their formulary, and those heart drugs come with a $0 copay, as opposed to the 50% copay or the $50 or 50% coinsurance, $50 copay they might see at tier 4, tier 5 on other non-SNP MAPDs. So right off the bat, there's potential cost savings for the drugs your beneficiaries might be taking to treat their heart condition. Also, you'll note here there's a $35 specialist copay, which does up and down, looking at some plan information, a lot of plans have that $45, $55 specialist copay somewhere in between. This plan gives your folks a break when they go to see the cardiologist or the endocrinologist to treat one or both these conditions. Should also point out that there is no copay for any lab services on this plan here as well. So of course, they're going to be monitoring those conditions with blood work and so on and so forth. So that's helpful to know about. And there is a $2,000 dental maximum on this plan with no co-insurance. As we all kind of know, but maybe not know, dental health and heart health are very closely linked. So it's another way Humana helps to take care of folks with those conditions here. So again, not a $0 cost sharing plan, but the benefits are designed in a different way than a traditional MAPD would, and really built to target that condition and provide some value for your members there. Chelsea, want to toss it back over to you here to wrap us up for you for the day.
All right, cool. Glad to have a little bit of a rest there. While you gave some great insight on some of those SNP plans that we have out there. So I'm just going to go over some of very quickly before I let you all go today. Some of the SNP features that I would kind of think about, or I would mention if I were an agent and I was selling these plans, that are applicable across the board. If I had to have some quick memorization points of things that I would want to talk about with clients. So let's just hop into those really quick. None of this should be new information to you. It's just kind of things that you could remember, again, when you're selling these products that are going to apply across the board to all of your SNP plans. So prior authorization is required, requires the provider to ask for approval, and they are not allowed to revoke a prior authorization for any reason, if the person is in a SNP plan. So those prior auths will carry over if anything changes for them between the time that they get that authorization and when they actually get that treatment, such as a plan change, network change, or provider change. But with SNP plans, once prior authorization is given for something, it cannot be revoked for any reason until the beneficiary gets that care. So again, if you have a beneficiary who has been burned by prior auths before, that might be a great talking point for that client. Plans cannot charge more than Medicare for certain services. Another rule of that SNP plan is this. Some of those things that are this applies to might be chemotherapy, dialysis, and skilled nursing facility care. But flip side, they can, however, charge higher copays for home health care, durable medical equipment, and inpatient hospital care. So unless you're looking at one of those more niche copay things, most of the services that are provided by a SNP plan are going to have the same price as the Medicare version. And then last but not least, SNPs are required to include Part D coverage, and sometimes they even will have dental, vision, and hearing, as we mentioned earlier. There will be no need to sell a PDP to your beneficiaries. All SNPs are required to provide Part D. Extra help can apply to that Part D coverage. So if they are someone who qualifies for those things, perfect opportunity to remind them of that benefit as well with those lower copays for your drugs. Dental, vision, hearing can be added to SNPs, but aren't always. They are an option that is available. So check in with that plan to make sure you know what you're selling for sure. But oftentimes dental, vision, hearing can be added and is available in those plans like we talked about earlier. If you have any questions, now is the time to throw those out there to us. Randy, is there anything you want to add before we close out today's session?
I just want to add that as you kind of listen to, especially at the back end about what products you might be interested in offering your clients, we're happy to help you add any or all those carriers to your portfolio. So you have one more tool in your belt to help some of your folks who might be Medicaid eligible. Something like 1 in 20 Medicare recipients is Medicaid eligible, but only about 20% of that number is actually enrolled in D-SNP, meaning there's lots of people that aren't yet getting the low cost, or the low premium or no premium care that they might want or that could benefit them. Other thing I want to point out is, unlike any other MAPD that really your big selling window is when someone either ages in or during AEP here, which we're in, because you can enroll in the SNP as soon as you meet the eligibility criteria. Those are plans that can be sold year round. So it's not something just to think about here during AEP, something to always have in your arsenal as you are working with your clients throughout the year. Those are the big things I wanted to make sure we hit before we close out today.
That's a really good point. I forget about that one as well, that the SEP starts when the person is diagnosed with that illness. So while it might not be as likely, I guess, that a client is going to waltz into your office because they get a disease. Most people, their first reaction isn't to run to their insurance agent. It is something you can bring up to your clients when trying to find their right fit, right? As if you were diagnosed recently, you might qualify for that special enrollment period for that SNP. I believe that's about it for today. I'd like to thank you for joining us today and talking about SNPs.